Have you ever woken up in the middle of the night gasping for air, your heart pounding for no reason at all? Or maybe you felt that strange tingling in your arm after sleeping on your side for too long? Most people brush it off. They roll over, fall back asleep, and forget about it by morning. But what if I told you that the position you sleep in every single night could be quietly putting pressure on your heart, your blood vessels, and your brain, increasing your risk of a stroke while you're completely unconscious and unable to do anything about it? I'm Dr. Mark, and over the years I've reviewed countless cases where patients came in with symptoms that seemed to come out of nowhere. A stroke, a TIA, a sudden spike in blood pressure first thing in the morning, and again, one factor kept showing up in their history: the way they slept. Not how long, not even how well, but the actual physical position their body was in for 6, 7, 8 hours every night. Here's the thing. Your body doesn't stop working when you fall asleep. Your heart keeps pumping. Your blood keeps circulating. Your brain still needs a steady, uninterrupted supply of oxygen-rich blood. And certain sleeping positions can interfere with that process in ways most people never think about. Tonight, I'm going to walk you through exactly which position has been linked to a higher stroke risk, why it happens, the warning signs your body might already be sending you, and, most importantly, what you can do about it starting tonight. So if you've ever woken up with numbness in your arm, a stiff neck, headaches that seem to come from nowhere, or you just want to protect your brain and heart while you sleep, stay with me until the end, because this information could genuinely make a difference for you or someone you love. Let's start with the basics. Stroke happens when blood flow to part of the brain is interrupted, either because a blood vessel is blocked or because it ruptures. Most people associate stroke risk with things like high blood pressure, high cholesterol, smoking, diabetes, or a sedentary lifestyle. All of that is true, and those are still the biggest factors by far. But there's a growing body of research looking at something more subtle: how body position during sleep affects blood pressure, blood flow, and even the way our blood clots overnight. Now, here's where it gets interesting. Several studies, including research presented at major sleep and cardiology conferences, have looked at sleep position in relation to conditions like obstructive sleep apnea, nighttime blood pressure surges, and even the timing of strokes. And one position that keeps coming up as a concern is sleeping flat on your back, especially for people who already have risk factors like obesity, sleep apnea, or high blood pressure. Why? When you lie flat on your back, especially if you're overweight or have a larger neck circumference, the soft tissues in your throat are more likely to collapse and partially block your airway. This is one of the main reasons obstructive sleep apnea gets significantly worse when people sleep on their backs compared to their sides. And here's the connection to stroke. Every time your airway partially or fully blocks during sleep, your oxygen levels drop. Your body responds by triggering a stress response. Your heart rate spikes, your blood pressure surges, sometimes dramatically, multiple times an hour, all night long. Over months and years, these repeated overnight blood pressure spikes put enormous strain on your blood vessels, including the arteries that supply your brain. Research has consistently linked untreated sleep apnea to a significantly higher risk of stroke, and back sleeping is one of the biggest drivers of apnea severity in people who are prone to it. Let me give you a real-world example of how this plays out. Imagine someone, let's call him Robert, 58 years old. Robert was a heavy snorer. His wife used to joke that she could hear him from the kitchen. He always slept flat on his back, arms at his sides like he was posing for a photo. He felt tired most mornings but chalked it up to just getting older and working long hours. What Robert didn't know was that every single night, his airway was partially collapsing dozens of times an hour. Each collapse caused a brief drop in his oxygen levels, followed by a surge in blood pressure as his body jolted itself awake just enough to start breathing again, without him ever fully waking up. This cycle repeated, night after night, year after year. The cumulative strain on his arteries was happening silently, invisibly, while he slept soundly, believing everything was fine. This is exactly the kind of pattern that researchers have found correlates with increased stroke risk over time. Not from one bad night, but from thousands of nights of repeated cardiovascular stress. Now, I want to be very clear about something, because this is important. Sleeping on your back does not automatically mean you're going to have a stroke. For many healthy people without sleep apnea or significant cardiovascular risk factors, back sleeping is perfectly fine and even recommended for spinal alignment. The concern specifically applies to people who already have risk factors: sleep apnea, obesity, high blood pressure, a thick neck circumference, or a family history of cardiovascular disease. If that describes you or someone in your life, this is information worth paying attention to. So, what position is generally considered better for these higher-risk individuals? Side sleeping, particularly the left side, has been associated with reduced apnea severity in multiple studies. When you sleep on your side, gravity is less likely to cause the tongue and soft tissues to fall backward and block the airway. This means fewer oxygen drops, fewer overnight blood pressure surges, and less cumulative strain on your cardiovascular system over time. There's also an interesting secondary point related to circulation. Some research has explored how sleeping position might affect lymphatic drainage and venous return, basically how efficiently fluid and blood move through your body overnight. While this area needs more research before we can make strong claims, the overall pattern from multiple studies points in the same direction. For people with existing risk factors, side sleeping tends to be associated with better overnight cardiovascular markers compared to back sleeping. Let's talk about another scenario. Picture someone named Linda, 62 years old, recently diagnosed with high blood pressure that her doctor described as well controlled during the day. But Linda kept waking up with headaches, specifically in the mornings, which is actually a classic sign worth paying attention to. Morning headaches can sometimes indicate that blood pressure is spiking overnight, even if daytime readings look normal. After being evaluated, Linda discovered she had mild sleep apnea that hadn't been previously diagnosed, largely because she always slept on her back and her snoring had gotten progressively louder over the years without her realizing it. After working with her doctor on treatment, which included addressing her sleep position alongside other interventions, her morning headaches improved significantly. This is a great example of how a seemingly small detail, like which way you're facing when you fall asleep, can be a piece of a much larger puzzle. So, what are the warning signs you should actually be watching for? First, loud or frequent snoring, especially if it's gotten worse over time or if a partner notices pauses in your breathing. Second, waking up gasping or choking. Third, morning headaches that improve as the day goes on. Fourth, excessive daytime fatigue even after what feels like a full night's sleep. Fifth, waking up with numbness or tingling in an arm or hand. This can sometimes be related to nerve compression from sleep position, but combined with other symptoms, it's worth mentioning to your doctor. And sixth, this one is critical. Any sudden new symptoms like facial drooping, arm weakness, or slurred speech, even if they seem to resolve quickly, need immediate medical attention. These can be signs of a transient ischemic attack, sometimes called a mini-stroke, which significantly raises the risk of a full stroke in the near future. Now let's talk about practical steps. If you tend to sleep on your back and you have any of the risk factors we discussed, snoring, sleep apnea, high blood pressure, obesity, or a family history of stroke, here are some things that can help. Try a body pillow or a pillow wedge behind your back to encourage side sleeping and make it harder to roll onto your back during the night. Some people use the old tennis ball in a t-shirt pocket trick, sewing a pocket onto the back of a sleep shirt and placing a tennis ball inside, so rolling onto your back becomes uncomfortable enough to shift you back to your side without fully waking up. Elevating the head of your bed slightly, even by a few inches, can also help reduce airway collapse for some people. And of course, if you suspect you might have sleep apnea, getting a proper sleep study done is one of the most valuable things you can do, because treating apnea doesn't just improve your sleep quality, it can meaningfully reduce your long-term cardiovascular risk. I also want to touch on something people don't talk about enough: the role of neck and shoulder position. Sleeping with your neck at an awkward angle, too high a pillow, or twisted to one side for hours can sometimes affect blood flow through the arteries in your neck, particularly in people who already have some narrowing or plaque buildup in those vessels. While this is a less common concern than sleep apnea, it's part of why doctors generally recommend a supportive pillow that keeps your neck in a neutral position, roughly aligned with your spine, regardless of which position you sleep in. Here's my final point, and I think it's the most important one. Your sleep position alone is rarely going to be the single cause of a stroke, but it can be one piece of a larger picture. A piece that, when combined with high blood pressure, untreated sleep apnea, excess weight, smoking, or a sedentary lifestyle, adds meaningful risk on top of risk. The good news is that this is one of the few stroke risk factors that costs nothing to address. You don't need a prescription to try sleeping on your side instead of your back. You don't need surgery to add a supportive pillow or talk to your doctor about whether a sleep study makes sense for you. If anything in this video resonated with you, if you recognized yourself or someone you love in Robert's story or Linda's story, please don't just watch this and move on. Talk to your doctor. Mention the snoring, the morning headaches, the daytime fatigue. These conversations can feel small, almost not worth bringing up, but they're often the first step toward catching something significant before it becomes a crisis. Your heart and your brain work for you every single second of every single day, including the 8 hours you spend completely unaware, lying in bed. Give them the best possible environment to do that job safely. Make one small adjustment tonight. Try sleeping on your side instead of your back. Set up your pillows to support a neutral neck position, and pay attention to how you feel in the morning over the next week or two. If you found this helpful, please consider sharing it with someone who snores loudly, someone who's mentioned feeling exhausted no matter how much they sleep, or someone managing high blood pressure. This kind of information spreads best when people who care about each other pass it along. Subscribe if you want more breakdowns like this one, where we take real research and turn it into practical steps you can actually use. And, as always, this video is for educational purposes and isn't a substitute for personalized medical advice. If you have concerns about your stroke risk, your blood pressure, or your sleep, please talk to a qualified healthcare provider who knows your full medical history. Take care of that heart of yours. It's the only one you've got, and it's working hard for you even while you sleep. I'll see you in the next one.